My same question. I said behavioral health, but mental health. What are the kind of apps you're seeing that help people with serious mental health illness, schizophrenia, but also the garden variety depression?
Well, you know, it's really interesting. Cognitive behavioral therapy and exercise. I was once at a continuum care forum meeting, and I asked someone who had talked about, you know, had they collated the effectiveness of their treatment methods with the amount of physical activity that somebody's doing. So I think that we have a lot of work to do in terms of pulling together how physical activity can affect depression and mood and a number of other factors along with social engagement. And just like we have to build a psychograph, that psychograph we're talking about, mediographic profile, is going to vary by disease states. And depression and schizophrenia and all the subsets of that are all unique within that. And when you look at areas like post-traumatic stress syndrome, there's a lot of really good work being done with the use of avatars, immersive learning by the VA with Skip Rizzo's labs. So if you look, you can find places that are doing work with the application of gaming on schizophrenia and others factors related to mental and cognitive dysfunctional behaviors. Take it away, Shahid, man.
Thank you, Doug. I'm human again. I found my phone. It was under a piece of paper on the podium. My wife has seen me walk around with my keys in my hand looking for my keys, so this is quite habitual. I don't deny it. Our next speaker is Shahid Shah, who is the CEO of NetSpective. I have worked in the trenches with Shahid. We've co-spoken together before. I consider him a kindred spirit when it comes to open data, data portability, and the need to have a more open healthcare system. I talk about it in terms of strategies, context, and business model. Shahid is actually going to be the guy who will tell you how to actually make it happen in terms of getting the electrons and the wires to actually connect. He knows far more about that than I do. Anyway, someone who I respect a lot. Take it away, Shahid. We're happy to have you here. Thanks for coming.
Thanks, Vince. All right, so my job this afternoon is to pop a few bubbles, maybe around healthcare disruption, and get back to what I call actionable innovation. Many of you are probably coming from either innovation shops inside your company, or you're coming in from entrepreneurs, or you're just interested in the industry at large. And so what I'm going to try to do is to give you a sense of how big the healthcare market is and where we should focus on innovation. And so you've already heard a lot this morning, great stuff about where wireless and mobile and everything else is heading, but hopefully I'm going to give you a little bit different viewpoint on how to think of that from the innovation and entrepreneurship perspective. So I'll skip over who I am. This presentation, by the way, if you want access to it, it's up at all of my presentations I do is up at speakerdeck.com/Shah. So this is up there now. If there's anything on there that you like, you're welcome to grab it. What I'm going to try to cover today is the size of the market and why disruption in healthcare is actually a lot harder than we think. And to understand that, just try to imagine what $1 trillion looks like. And everything that you see up in gray up there is $1 trillion. $1 billion is that little thing in red. Now, whatever you think that is important in healthcare that you're going to go disrupt, you're just not going to do. You'd have to affect, and there's 3 of these trillions in our healthcare industry. One of those billion, if you could even get $1 billion out of whatever idea you have, it's a big deal, right? But it's not a disruption. So one way to think about it is, it's completely okay to have a great idea in healthcare that is focused on a very narrow but very important topic and yet not disrupt healthcare. Doesn't mean that it doesn't have a lot of value. So I work with a lot of startups, probably on the order of 50 to 100 startups a year for grant programs in government, all the way through to entrepreneurs, etc. And I was just telling somebody this morning that if I hear one more time what do you do as a healthcare startup? Well, I'm about to disrupt healthcare. No, nothing you do is going to disrupt healthcare, but it's okay, right? First and foremost, nothing, absolutely nothing that you're going to do, nothing that the government can do can disrupt healthcare, so nothing that you can do can disrupt healthcare, but it's okay, you don't have to. right? The second way to think about this is whatever little mobile app you have, sophisticated data structures you're going to create, the coolest device, which I've worked on many medical devices, nothing that you do in there is going to disrupt healthcare. But it's okay. You don't have to. All you have to do is add a little bit more value here, add a little bit more value there, extract something from this place that's not coming out, and push it to somewhere else. It's okay to not be disruptive in healthcare. The next one to think about is, however you want to incorporate doctors, you're not going to be able to do it. However you want to incorporate patients, you're not going to be able to do it. But you can do it with 10 doctors. You can't do it with all of them. You can do it with 100,000 patients. You can't do it with 10 million of them or 50 million of them. But it's okay. You don't have to. You can just start with small slivers and go with that approach. This last one here is, we often focus and say, you know what, if only the existing medical device vendors, or if only the existing electronic health record solution vendors would simply put my super cool, great idea into the clinical workflow, everything would be great. Well, let's be realistic. Nobody gives a crap about your software. Nobody gives a crap about your device. They're not going to install it into clinical workflows just because you ask them to. Why? Because you're asking them to take on new legal liabilities. Why would they do it? Why would they take on something that's going to make their product less competitive potentially and give them more heartache? It's just not going to happen. Second item there is, the other reason they're not going to do it is they're not going to allow competing devices to come in without finding a way to get paid for it. So as you're thinking through all of this and your brilliant idea and your great mobile app and you've got a nice platform that you're building, try to think through and say to yourself, do I need to disrupt healthcare or something much smaller? And so that's what we're going to concentrate on for the rest of this talk. Here, in the device-focused world, what you want to think about is, what is the true innovation, what I call actionable innovation, are you working on? So actionable innovation has to be, and I kind of kid us in our market here, where it used to be that innovation in healthcare meant that you cured something. Now let's just think about that. Healthcare used to cure things. When was the last time we cured something? It's been a while, right? So what do we have to do? We have to take whatever else is left over now and call that innovation. And so think about these two areas. Innovation area number one is that you're doing something for physicians to make their diagnosis, therapies, etc. better, or you're doing something to patients to directly impact their healthcare. If that's the case, then you've got some innovation. So I'm going to run through real quick. This is a preview of a couple of things that I'm going to talk about in my talk tomorrow morning. It's at 8:15 in the morning. I don't know if you guys will be awake, but we'll chat about this a little bit. Is what kills us today is very different than what killed us even less than 100 years ago. And so we have life expectancy going up, which is good. It used to be that about 100 years ago, back in the 1900s, bacteria was the thing that killed us most. Today, however, it's mostly infections. If you look at, now in the case of most infections, we've got most of them beat, but there's still a couple of them, such as the flu, for example, that's still causing us grief. So why are these things important? If you're not looking at the trends of what's going on in healthcare when you're doing your innovations, you're really not doing any innovating. You're building something that you want to build and hoping that it's going to fit somewhere, as opposed to looking at the problems and going down that path. So look at the top killers today. 100 years ago, we were looking at a variety of different things. Today, heart disease, cancer, chronic lower respiratory diseases. So whatever your innovation is, better be concentrating on the things that are killing us today, because that's the first place we're supposed to be concentrating. Now, up here, we look at this age distribution. 100 years ago, we used to die at pretty much equal age groups. You see that on the left-hand side? It's a little bit hard to read. But the key thing to look at is the total number of deaths, whether you were young or old, was about the same. Now we're seeing most deaths occurring at the much later rates. Why is this important? Well, I mean, if you're trying to produce these innovations, this is where you have to go focus your efforts. Now, in here, there's been a talk about what business are we in? Are we in the life improvement business? Are we in the health business? So New England Journal of Medicine had a nice little article, I think it was a few months back, talking about the business of health. And if you haven't, and the reason why I gave this reference, if you go to speakerdeck.com/Shah, slide 16 has this. I'd recommend everybody read this. Because once you recognize what business you're in, then the innovations that you work on become a lot easier because you're able to tie it up together. So all of this is to drive around one key area that almost all the startups that I work with get wrong. And they believe, and that is that they believe they have a customer. You don't actually have a customer. You have 3 constituents that you're dealing with. And I just call this the little PBU constituency. The payer, the benefitter, and the user. Most startups, most people working in innovation teams have a pretty good idea about the users. They look at the users, they understand who they are, etc. What they get absolutely wrong in most cases, and this is why in health startups aren't as successful as one would like them to be. In other industries, the reason why you can disrupt so much faster is that the person using the system and the person benefiting from the system and the person paying for the system, or the company using your software and the company benefiting from your software and the company paying for your technology are usually the same. In healthcare, they're almost never the same. So in this case, as you're coming up with your brilliant ideas, have you laid out and said, well, these are my users, these are the people that are going to benefit from it, and these are the payers of it? I mean, think about why is the government having to give out billions of dollars in incentives to get electronic health record solutions? Because they don't benefit the guy doing the data entry as much as payers and other groups. Now, once we align those things and get it to where the payer and the benefitter and the user are roughly equivalent, you're going to see a much faster adoption of many of the technologies that we're hoping get adopted. Let's not kid ourselves. Everybody raised their hands about their mobile use, etc., but most of you are not using your mobile phones to help you manage health in the same way that you use it to help you manage your email. Let's not kid ourselves that we're using it to help us get better fit, etc., in the same way that we use it to connect with our wife and see what we need to pick up at the end of the day through SMS. So this is what the problem is. We're kidding ourselves into thinking that we're a lot further along than we really are because we don't understand the fundamentals of why businesses work the way that they do, and then why does it not work in healthcare. It doesn't work in healthcare not because we're stupid. It's because we have a much more complicated industry. We're 3 times bigger than the next industry at our size, at the $3 trillion size, and you have to make sure you understand those nuances. So this slide I want you to take some special attention to. Again, if you go to speakerdeck.com/Shah, you'll see this. If you focus on and say, well, I'm in healthcare, you're doing yourself a disservice. You're not in healthcare. You're in some obscure, tiny little segment of healthcare. But that's okay. You're not going to disrupt healthcare. It's okay. Find your tiny, obscure, little niche segment and define it really, really well. So if you're going after patients and you have 350 million patients in the United States alone, add that to 450 to 500 million in North America, potentially Latin America as well, you have a pretty nice sized market. But that's not your addressable market. You can't do diddly squat with 500 million people. But you can do it with 1 million people. You can do it with 500,000. Just yesterday, I had a call with one of the winners of an ONC-sponsored event a New York Collaborative Health event, where they won one of the challenges for building a personal health record, which was great. They won a challenge, but they're having trouble getting people to use that software in their environments. And so we had a long talk about why that was. Well, because you can't make a PHR, a patient health record, or a personal health record for every patient in the country. If you're going to make a personal health record, make it, for example, for cancer patients who just found out that they got cancer. That thing, you may only have 300,000 patients rolling every 3 months, but at least you can identify them, right? That's what this slide helps you do, is to identify where are the costs, where are the patients. So for example, if you're in the lifestyle and fitness business, what are you worried about here? If you look at on the left-hand side, the well patients are 26% of the population, but they only have 4% of the cost. If you're in the business of helping 26% of the population manage their cost, that's just silly. It doesn't make sense. The cost isn't there. Now, walk your way through and say, okay, can I make something for the at-risk patient? Can I make something for someone who has just gone into chronic care? So if I'm in the cost reduction business, and I'm trying to focus on reducing costs, should I be focused on one of these three areas where there's 4% of the population but 36% of the cost, or should I focus on 4% of the cost and 26% of the population? There's no right answer here, by the way. The right answer is that you've thought through it, that you've done the analysis and you understand that there's a huge distinction between someone sitting on that side versus someone sitting on this side. Right? So the key to understanding your customer, and it seems pretty obvious, right? Of course you should understand your customer. The problem is we see dozens and dozens of startups, even big companies in the healthcare sector starting an innovation team. You've got a VP of innovation who hasn't done the basic analysis to say, what am I innovating? What am I trying to do to which patient population, which specific tiny sliver of patients that I'm dealing with? Now, this here is just a set of questions. I mean, if you're making electronic health record software and you're saying that this is a certified EHR, really? Is it for a large hospital? Is it for a medium hospital? Is it for a small hospital? How many number of beds is it going to have? Is it in a rural setting? Is it in a urban setting? Now, if you're producing software or hardware or devices or anything, and you haven't segmented it down to some very, very specific sliver. Now, in most other industries, if you go too narrow, you become tiny and usually inconsequential. In our world, a tiny sliver is still $1 billion. It's completely okay to not disrupt healthcare. It's completely okay to say, I'm getting narrower and narrower and narrower until I find the things that I can identify. One of our biggest problems in healthcare, especially in startups, and the innovation groups is, how do you identify the patients that you want to go after? How do you identify the docs that you want to go after? The nurses that you want to go after? Well, you don't. You don't spend the bare bones minimum making sure that the actual analysis is happening. So here, for example, these are just rough questions, but if you're not asking these kind of questions, clearly your innovation is for you. It's not for the customer because you didn't discover who the customer was. So for those of you who haven't read it, Steve Blank's customer development book sets are pretty good. They're often not used in healthcare, because one of the things he says in his books is you should be living with your customers. So how many of us who are building healthcare technologies actually live with the doctor or live with the patient or live in the hospital or live in the payer community that we're trying to serve? So very difficult. This is not easy. I mean, this should take us months to get done, the research and the analysis necessary, and no amount of software work, no amount of API that we create. So that's a world that I live in. I write APIs for a living. I write software for a living. I write code for a living. But the problem is we know how to write all this stuff. We don't know how to get it in use because we're not doing the basic analysis here. So the question here becomes, the first part you should answer is to say, who are my customers? And so if you've got a good identity there, that's okay. Now you need to figure out how are they going to pay for whatever it is that you think you're going to put into use. So aside from government and aside from very large nonprofits, the rest of us have to worry about this. If you can't figure out how it's going to be paid for, it's just not going to be successful. And the cool thing that you made doesn't actually work. Now, the most important thing to think about here is it's not that you have to discover the payment, but you have to discover it and you have to teach your customer that that's the payment model that they should use. So the best thing to do is figure out if you can get directly paid, that's awesome. But think about the other two, the direct reimbursement and the indirect reimbursement. So CMS is doing a nice thing. I mean, you may have seen the announcement a couple of days ago that they are considering paying through patient-centered medical homes the ability for certain physicians who work through primary care and patient-centered medical homes, the ability to manage chronic patients. 60 days, 90 days, etc. It's not a final rule, but it's a proposed rule. That is a huge deal. Why? Because we're talking about something moving from indirect reimbursement to direct reimbursement. If you're working on an innovation and you haven't figured out which category here you fit in, you've got no innovation because you can't get it used anywhere. Right? So you got to focus first to say who's the payer, who's the benefiter, who's the user. It's okay if I'm not going to disrupt healthcare. I'm going to dive deep, go narrow, and dive really deep because even a narrow, deep sliver of healthcare is $1 billion market, $100 billion market, $100 million market. Then I figure out where do I sit? Which of these areas can I, not just that I know it, but my buyer knows where they sit. So when you're sitting in front of them, you're doing you're writing a white paper, you got a case study going, you understand what the marketing looks like, you better be showing your customers how to buy the software that you have, how to buy that innovation that you have. Now, the other thing to think about is many of our startups and innovators forget the fact that there's a regulatory framework that we need to fit under. Where do you fit in the regulatory framework determines how fast you're going to get out and how quickly and how easily that software or hardware or device or business model is going to be adopted. On this side, you see the least regulation, where things like patient education and patient administration. So patient administration is typically where EHRs sit. Content is on the patient education side. But as soon as you start moving to diagnostic tools, therapeutic tools, and therapies, what is your strategy for ensuring that you've got the right sliver, that you've got the right customer, and you know what your regulatory impact is going to be? So in this case, what I say is don't be afraid of the regulation. Just know it and understand it. In fact, if you're doing something in the patient administration side, and you have a gut feeling that a few years from now, as I do, that even electronic health records in a few years will be regulated more than they are regulated today, very similar to how mHealth, mobile health, the devices will start getting regulated. Whether it's the FDA that does it, whether it's ONC that does it, we don't know, nor should we care. Just assume that it will become regulated. So what do you do when something is regulated? You do a much better engineering job. You do better design analysis and documentation. So when you're doing these things, just do it the right way. Do it as if it's already being regulated. And engineering is not that much harder. As an engineer for 20 years, I'm telling you, it's not that much harder to do it the right way with proper documentation, proper design, proper approaches, proper process, etc., than it is to cut through the chase, do something quickly, and throw together something that does not have all of that backing material. So think about the competitive advantage that you will have if you're creating something today that is about to be put into use 2 or 3 years from now in a higher, more adoption later on. Wouldn't it be better if you were ready for whatever regulation was going to come down? Instead of fearing it today and saying, you know what, I don't want to put this feature in because I might get regulated, or I'm not going to put that feature in because I might get regulated. Your customer doesn't care whether you're regulated or not. They care whether you're giving them something useful. And if that something useful that you are giving them causes you to become regulated, that's okay. Why? Because it's a competitive advantage for you as well. There's a barrier to entry once additional regulations put in that actually protect incumbents. That's not a good thing to say from a marketing point of view, from a industry point of view, from a patient's perspective. But if you're building something and you're putting in tens of millions of dollars worth of investment, it's good to know that you have some protection from someone else who just could come out and copy what you're making. And it's not about patents and other things. I mean, those IP protections and things are important. But one of the biggest problems that I've seen, especially folks who are working in mobile today, and the side of health software that's getting into this point, the diagnostic side. In the therapeutic side, they're actually pretty good. But there are a lot of mobile apps that are moving from education to slight diagnostics. And they say, well, if I put this feature in, I don't want to do that because then the FDA is going to start regulating me. That's just crazy. If it's useful to your customer and it can sell your product, do it. And that's what's important about this. Now, so one other thing that has been talked about a lot this morning is what is the specific problem that you're trying to solve? And that doesn't mean that I'm trying to create health or I'm trying to get engagement, etc. That is a process by which you're going to solve your problem. What is the actual problem you're trying to solve has to be something that is both important to the buyer as well as the user and the benefiter. But more importantly, you have to know what it is, because if you've got a team of guys like me, if you've got 20 engineers, and every one of us has our own great ideas, because every engineer is the smartest engineer that he knows, you're going to find out that there's a lot of variation in what gets created. And so when we go through this, it seems like one of those obvious things is to say, well, of course we know what problem we're solving, but I bet you walk into half of the shops, you pull together engineers, they couldn't answer this question for you. They hope that somebody in product management knows it. They hope that somebody in marketing knows it, but it's not important for the engineers to know it, right? That's just crazy. It's insane. These things Are you in the payment modeling business? Are you in the pricing transparency business? What business are you in? You're not just in innovation. You're in doing something useful for some buyers, some benefiter, some payer. All right. Now, here, what I talk about here is identifying the best opportunities is not easy. And so there's a reference here, down here, to this particular Harvard Business Review article on the 5 C's of opportunity identification. And so one of the drawbacks that I've seen today is, and this is not a knock on any of the government folks. I mean, I do plenty of work with government right now. But what's happening is that the government it has a lot of challenges and a lot of programs where there are contests are being run, which are awesome. I think they are absolutely necessary. The problem is that a lot of entrepreneurs are chasing the contest. They're chasing building an API. They're chasing building that instead of running through and figuring out based on their customers, their needs, etc., what is the specific innovation that they're trying to come out with. And so what's happening is that we're getting a lot more software. Like this company I spoke to a couple of days ago, they built this thing. They built it in 6 hours. Now, that wasn't a big deal. Building a nice-looking PHR in 6 hours is not a big deal. Why? I've been in this business for a long time. We could throw a lot of cool stuff together in a very short amount of time. But it's going to take those poor guys months to figure out how it's going to get paid for. And that's really where additional help is needed from a government, from nonprofits, et cetera, is helping figure out once the challenge has been won, somebody's got something done, how do these companies, and this is done in more formal grant programs like the NIH grant program or the NSA, the NSA actually has a grant program, but the National Science Foundation's grant programs, et cetera, they have a process by which you come up with the idea and then they help you commercialize it. That's a slight weakness that I see right now is that we've got a lot of things going on where technology is being built. But as we all know, that's the least of our problems. It's not the end of our journey. It's the beginning of our journey to have the product that you think that you want. Now, up here, the question around payment design comes up. A lot of us are more involved in the, quote, sexy side of patient care, things like personal health records, electronic health records, mobile devices, etc. But many of our problems right now stem from the fact that we don't have direct access to an understanding of the payment models and where we sit. So with this particular thing, I'm going to go ahead and start wrapping up here, and if you have some questions, please do ask. But as I mentioned, there's a little bit more content here. I do this presentation usually annually at the NIH SBIR program, the Small Business Innovative Review. And so a lot of what I talk about is specific to innovative companies trying to move forward. But one place where I've seen very little attention being paid is to help out on the payment reform, payment models, payment designs, et cetera side. So if there's anybody trying to do work in that area, there's plenty of opportunity. I mean, if you think it's not as hard to sell something to a payer, like a health insurer, as it is to sell something to a hospital. If you've got something cool and something useful, definitely think about that. So with that, I'm going to wrap up here. Any questions before I get yanked off the stage?
Thank you. A really nice presentation. Could you say a little bit about channel strategies? One of the things, obviously, that a lot of us encounter is just the difficulty in forming contracts. And because it's such a large industry, no matter what you do, you're going to interact with other groups. So that would seem a natural way for a lot of technologies to make their way out. Yeah, your best bet initially is to go the indirect reseller channels. So depending on where you're going, let's say you're going, if you have a B2B, a business-to-business sale, that can be done in a direct way for your first couple of businesses. But the reseller channel in healthcare almost always works best for you. So unless you're talking about something that you can sell on your own to single doctor groups, et cetera, most healthcare institutions have a much better relationship with someone else that you may know, or a reseller that they have been working with, or a distributor that they've been working with, especially in the device world, et cetera. So if you're not sure about what channel to choose, go straight with, not a strategic partnership, by the way, that's the worst kind of strategy. Go for a reseller strategy where you've got a product done, it's beta tested, but it hasn't been fully launched, but the guys in the resale channel can make a ton of money off of you.
at margins usually over 60%, by the way. So if you can keep 40 and they keep 60, they'll get you in. A couple of years later, you can invert that when you're more successful and the product is better known to a 35, 65 type of model later. Other questions? Okay, great. Thanks, guys. Yes.